With television shows like Extreme Makeover and Dr. 90210 making cosmetic and plastic surgery even more popular, everyone now wants to improve their looks. Dr. Ben Childers of the Riverside Plastic Surgery Associates in Riverside sees the trend to enhance and perfect faces and bodies increasing even more.
In general, the classic facelift patient would come in at 65 years of age. She would come in and say, I want a facelift. Personally, I'd like to see the patients coming in a little bit sooner than 65 years of age because the aging process has taken hold. The body itself has gotten older, the heart, the lungs are older, and there's higher chances of complications. The other thing a facelift will do in those earlier ages, it delays the aging process. So you can actually slow the patient down. There have been studies where we've looked at patients who had their facelift at similar ages, and it'll slow the aging process. When we see total body rejuvenation, patients come in for their face, women especially come in for their breast. One of the things that I've noticed in my practice probably over the last 2 years is we're more into proportion, body proportion. We're also seeing patients wanting more plastic surgery. They want to do their breasts, they want to do their belly, they want to do their legs. So we've been actually increasing the length of the surgeries to a certain point, rather than just doing one surgery at a time. As a plastic surgeon, what I do is the post-gastric bypass patients. Those patients who come to me after they've had their gastric bypass, whether it's a stomach banding or an actual reducing the size of the abdomen, of the stomach, I do the post-surgery work. What we see is the face needs to be worked on. Generally, the abdomen needs to be worked on with the large amount of tissue they have on their stomach. Their breasts generally have gone from a breast that's full and very large to something now that's small and quite saggy. And then also the legs. I do work on breast cancer patients. I still find doing breast reconstructive almost a mission for me for these patients. Breast cancer reconstruction is very important for these patients. They get diagnosed with breast cancer. The first thing they think of, they're going to die. The next thing, after the smoke clears, then they realize they want to do something about it. And it's very hard for these patients to figure out what they want to do, let alone having whether or not they're going to lose their breast, whether they're going to have a radiation or chemotherapy. As a plastic surgeon, I do like to see these patients early on when they're diagnosed with breast cancer because I can help clear some of that smoke and help give them further direction as to which way they want to go, whether they want to have complete mastectomies and further reconstruction. I am a hand surgeon. I have done a hand fellowship and a microsurgery fellowship. Many of the plastic surgeons that are trained do have an added expertise in surgery. For instance, in my career, I've done 4 hand replants, hands that have been cut off, and we put them back on. I've also done a number of finger replants that would fall under the hand surgery, microsurgery. One of my patients that comes to mind was a dentist who actually amputated 3 of his fingers with a table saw. And we actually put all 3 fingers back on, took 12 hours and 15 minutes. And with therapy and with time, he actually went to continuing practicing dentistry. That was probably one of my most rewarding cases that I've worked on. The question may be, why aren't you in Palm Springs or Beverly Hills or some of these other big places? Well, there are a lot of other patients in the United States that need good plastic surgeons. And many of the people that are in Beverly Hills and Newport Beach, I personally trained along with some of my other colleagues. So I feel I'm very at home where I am now, and I think it's very nice that people in a community can have people that come from the big city.